The latest news, current affairs, and actualities.
Researchers at South Africa's Wits University have successfully enhanced the effectiveness of heat therapy to treat cervical cancer. Dr. Carrie Minnaar led the study at the Wits Donald Gordon Medical Center University. Now, the team began testing modulated electrohypothermia for cervical cancer in 2014. With over 10,000 new cases diagnosed and almost 6,000 deaths annually in South Africa, cervical cancer remains the second most common cancer among women in the country. Dr. Minnaar spoke to Channel Africa news reporter Tuto Ngobeni.
So hypothermia involves heating tumors to above normal temperature in the body. It's been around for many, many years, since the early 1900s actually, but it's quite challenging to heat up tumors without damaging the healthy tissue. So what we use is a technique called modulated electrohypothermia. And this enables us to mildly heat up the tumors very safely. And when this happens, we can increase the damage done by radiation and in some cases chemotherapy when we heat the tumor up before the patients have radiation. So what we did is we used this technique and we combined it with radiation and chemotherapy, and we studied the effects of the combined treatment in cervical cancer patients. So we had 210 women, and half of them had the standard treatment of care, and the other half had the standard of care treatment plus the hypothermia. And then we followed them up for 5 years. So this is very important because it's the first time this particular kind of hypothermia has been studied in a large trial, and it's the first time that any hypothermia trial has been done in South Africa or in Africa, and we included HIV-positive women as well. And what we found is that after 5 years, the ladies who had received the hypothermia treatment had more than double the chance of getting to 5 years disease-free. So that's quite exciting for us.
It can also reduce radiation costs effectively.
So what it does, it doesn't necessarily reduce the radiation costs, but once we did the trial, the research team from WITS also looked at the overall impact of adding this treatment to the public health facility or sector. And although the addition of another treatment raises the costs a little bit, what happens is because more women are disease-free, they're not coming back for recurrent treatment, which means we're saving the facility money because there isn't a recurrent treatment. And this frees up time and funding to treat more women the first time round. In the beginning, when researchers were first looking at hypothermia, they actually wanted to heat up the tumor to a high temperature, to above 43 degrees, because they wanted the hypothermia to actually damage the tumor by itself without combining it with any other treatments. Then in the early 2000s, some investigators in America realized that the high temperatures are very difficult to achieve. So they started looking at lower temperatures, so just a mild increase to about 39, 40 degrees. And instead of giving the hypothermia by itself, they combined it with radiation. And that's how this study that we've done is different to previous studies, because we are using a much lower temperature, which makes it very safe and very easy to administer. And we're using it in combination with the radiation. So it's called a radiosensitizer. What happens is when we heat up the tumor just a little bit, we get a rush of blood to the tumor, and this increases the oxygen in the tumor. And radiation does more damage when there's oxygen inside the tumor. And this also slows down the repair processes that the cells try to implement in order to repair from the damage done by the radiation.
And how long will it take before this technique is approved to be used at hospitals?
Well, we are busy writing up the results. We have presented them at a few conferences, but the paper still needs to be published. And as soon as the paper is published, we are quite hopeful that the awareness of this treatment will increase, and then there will be more of an uptake. But at the moment, there are two devices in the country, sadly not yet in the public health sector. I'm hoping very much that will come soon.
And just tell us about how cervical cancer affects women in terms of the challenges and dealing with it, how does it affect women, and how will this technique actually reduce the number of women who actually succumb to cervical cancer?
So cervical cancer is a really horrible cancer for women. It has a very high morbidity. In other words, it causes a lot of damage and discomfort and affects the quality of life quite significantly. And we have the highest burden of cervical cancer is actually in low to middle income countries, and that's because we don't have screening programs and vaccination programs that are as effective as other developed countries. So our women usually are diagnosed quite late in the disease, which makes it very difficult or harder to treat the cancer. And the financial restraints also complicate the management of the cancer.
All right, so that's a fascinating story. Dr. Carrie Minnaar at the Wits Donald Gordon Medical Center, University Oncology Department, speaking to Channel Africa news reporter Tuto Ngobeni.